We have Dr. Mohammed al Najjar on the line. He's an ICU doctor working at Al-Aqsa Martyrs Hospital in Gaza. Good afternoon, Dr. Najjar. Thank you for taking the call. I'll jump into the questions quickly. We don't think that the polio vaccination is going to reach the children of Gaza because the World Health Organization has stipulated that it can't do it without a ceasefire. What are the implications of children in Gaza not receiving the vaccine, given that at least 4 children have already contracted the disease?
Yes, I agree. Ceasefire or at least a humanitarian pause is mandatory, not only to enter polio vaccine, but also to give the children those vaccines in relatively safe and accessible. Otherwise, there will be pandemic because of the overcrowding and the bad hygiene conditions that we are currently living. This disease will mainly affect children and cause severe muscle paralysis, and it would lead to death.
Thank you. My second question is that there are several skin diseases that remain of unknown origin. Are there any laboratories left in Gaza so that the right medications can be requested, or will they never be identified and continue to spread?
Well, recently we have faced many skin diseases that are not responding to the usual medications. This is because of many reasons. First of all, to treat these skin diseases, you should isolate the patient, and this is not applicable here. Second, if these diseases are not treated properly, the patients would present in severe form and unusual presentation. Otherwise, overcrowding also play the main role in spreading those diseases. Finally, we also run off the basic equipment and lab tools to diagnose such these skin diseases.
Are Palestinian doctors having to work unpaid while their foreign colleagues are getting a full salary?
Unfortunately, I worked as ICU doctor from the first day of the war without any payment, but I must work to help my people to survive.
And finally, at Rebuild Gaza 24, we are currently trying to provide as many Palestinian people on the ground in Gaza with clean water by digging water wells. And I just wondered, how important do you think this is in the battle to prevent the diseases from spreading?
Yes, this is a great initiative and necessary step to minimize the spread of the infectious disease through contaminated water. But I think those wells will not cover all displaced people. We recently have had many hepatitis A disease, mainly due to non-clear water. Besides, there is also many other projects that you can work on, such as solar system to save medication like insulin, because we also have noticed many patients due to incorrect storage of the insulin.
Dr. Najjar, thank you very much for your time indeed, and we wish you and your colleagues well.